So I'm back on surgery starting today. I'm going to be on my first day of pediatric surgery. Let's get this bread. So it's only 10:30, but we already have 3 consults that we saw in the emergency room, some for appendicitis, another for trauma, which are pretty much, I think, the most common things that I'm going to be seeing here. And so obviously we're going to admit some patients, order some investigations for some of them, including some imaging to rule out any injuries in the belly. These normal images are from the internet, just to illustrate the point. I always try to look at any scans we do in case we need to operate, just to have an idea of what things might look like. But to be fair, I'm not a radiologist and I always end up waiting for the report. Oh, and also there's this appendicitis that was confirmed, so I'm really hoping that I can do it later. Usually these simple cases, they're going to go later on in the evening or at night, and junior residents like myself can take the opportunity to learn because they're such simple cases, so really hoping I get to go. In the end, this young girl actually had a small fracture of her spine just at the middle of the back. Here I'm just showing a normal scan of the spine to show images are quite nice to look at and easily identify any kind of fractures in the vertebrae. The rest of the day, I have to say, was pretty uneventful. A lot of it was getting used to handling all these patients, getting to know all the patients that we admitted under our team. And I was charged with the pager, which means that any consults that were coming from the emergency room would come to me and I'd be the first one to go see. So in terms of filming or discussing anything interesting, a lot of the day was dictating discharge summaries, writing notes. I also rounded with one of the staff surgeons to update her on some of her patients, and we discussed a bit of the cases with some radiologists. So it's about 6 now, and I just saw another consult in the ER, and it's actually for a 5-week-old who has green vomiting. Basically, when you have an infant under 1 year old who has green vomiting, you want to rule out a malrotation, which is basically a problem in how the gut is developed, and it is kind of turned in the wrong way, which actually is a blockage, and this is a surgical emergency if that is confirmed on further radiologic testing. Luckily, with a scan, this patient was confirmed to not have this problem. It's about 9 o'clock now, and I am exhausted. I actually realized that I've had my best Fitbit stats in a long time, so I'll put them up right here, and you can see that they're way better on surgery right now than on internal medicine, so I'm way more active. And part of it is also that I'm getting lost in the hospital and going back and forth between a lot of places, but I'm getting a lot of steps in, a lot of floors in, and I'm only about a bit past the halfway mark of my 24-hour call. So, oh, and also I totally didn't go to the appendectomy that happened a little earlier just because I was doing a consult in the emergency room, so I missed the opportunity to go to the OR. And so I'm really looking forward to the next time I go to the OR, just because I really want to get back into it and see how things are, and also just finally improve. I've basically done a third of my first year residency, and of course a lot of it has been non-surgical, so it's understandable, but I haven't been to the OR and haven't improved my surgical skills yet. So, I am a general surgery resident, but as a first year right now, I can't really say that I know how to operate anything right now. So I'm really down for some ice cream now. So they're kind of like late night snack.
On the outside looking in, I really wasn't sure what I was getting. Between the high waves on the sea, waiting for something to get to me. I wasn't sure what I was hoping for, you see. You act like
So things look pretty good right now. I'm gonna enjoy this. finish up a bit of dictations from patients I saw, which shouldn't take too long, and then probably go to bed and wake up in a few hours to take a patient's vitals and prepare before the team arrives to round in the morning. So I just finished seeing another appendicitis in the emergency room. This time it wasn't really a slam dunk case like the one we saw this morning. And so basically the history, the physical would suggest appendicitis, but we didn't actually have a confirmation on the ultrasound. They couldn't actually see appendicitis to confirm it. So without that, we don't want to make the firm diagnosis, even if technically you probably could bet your money on it. But in this day and age, actually, you probably, no one wants to bring someone to the operating room without having done some imaging. So we're just going to kind of repeat the imaging tomorrow and see. Sometimes things just aren't as clear-cut or as convincing, but you want to be safe and do the right thing. So that's where we're at. I'm going to get some sleep right now. So it's the morning, about 9 o'clock now, and I want to thank you guys for joining me on this first day on call in pediatric surgery. Hopefully this was interesting, and I'll see you guys in the next video.